From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus, North Carolina News Brief for Tuesday, June 2nd, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. At a press conference yesterday, Dr. Mandy Cohen, Secretary of the State Department of Health and Human Services, addressed what she called systematic injustice in the healthcare system as evidenced by COVID-19. The state's COVID-19 dashboard, a continuously updated database on coronavirus cases in North Carolina, shows that while African Americans make up 22% of the state's population, they account for 34% of deaths from the virus. The disproportionate effect of the coronavirus has devastated African American communities across the country throughout the pandemic. Environmental factors and a prevalence of pre-existing conditions such as heart disease and diabetes make many African Americans more vulnerable to the virus. According to data from the Centers for Disease Control, though African Americans make up only 13% of the U.S. population, they account for nearly one-third of coronavirus infections nationwide. In a press conference, Dr. Cohen said DHHS is requesting assistance from vendors to increase COVID-19 testing in historically marginalized communities in North Carolina.
We want to partner with minority-owned businesses and businesses that hire a diverse workforce. And we want those partners to focus their testing and tracing work on those historically marginalized communities in culturally appropriate ways.
Yesterday, the Congressional Budget Office said that the U.S. economy could be $15.7 trillion smaller over the next decade than it otherwise would have been if Congress does not mitigate the economic damage from the coronavirus. The CBO, which had already issued a report forecasting a severe economic impact over the next 2 years, expanded that forecast to show that the severity of the economic shock could depress growth for far longer. The new estimate said that over the 2020 through 2030 period, total GDP output could be $15.7 trillion lower than CBO had been projecting as recently as January. That would equal 5.3% of lost GDP over the coming decade. In a letter, CBO Director Philip Swagel said, quote, "Business closures and social distancing measures are expected to curtail consumer spending, while the recent drop in energy prices is projected to severely reduce U.S. investment in the energy sector." End quote. The CBO also issued a separate report detailing a cost estimate for a $3.4 trillion COVID-19 rescue bill that had passed the Democratic-controlled House in mid-May. That legislation is built around $915 billion in aid to state and local governments, another $1,200 payment to most American workers, and additional aid to colleges and school districts. Senate Republicans have dismissed the proposal, but have yet to present a bill of their own. A proposal to delay road test requirements for new drivers until the state's DMV gets back to normal operations moved forward yesterday at the NC legislature. The DMV suspended road tests in March due to COVID-19, leaving young drivers with no way to complete state requirements. House Bill 1189 would temporarily waive the required tests, provided drivers meet other state licensing requirements. The waiver would expire after the Division of Motor Vehicles starts offering road tests again, and new drivers would have to go back and pass tests at that point. The bill cleared the House Education Committee on a bipartisan, unanimous vote, according to committee co-chair Craig Horn, who said he'd heard from parents across the state asking legislators to waive the requirement. This is one of several bills addressing the situation, and the DMV has not taken a position on it. DMV spokesman Steve Abbott said in a text message that the division didn't have a hand in writing these bills and that it would track them through the legislative process. The bill now moves to the House Rules Committee. If it passes there, it would move to the House floor, then to the state Senate, which would have to approve it as well before the bill could go to the governor for his approval or veto. And finally, trips to the dentist may be more expensive in the time of coronavirus. Dentists say it's a direct result of COVID-19 and the added personal protective equipment that's necessary, considering the close personal contact required in a dentist's chair. In some cases, that equipment has more than doubled in cost during the pandemic, requiring dentist offices to pass the increase on to their patients. While dentist offices have widely remained open as an essential service during the pandemic, many are small local businesses who have struggled to survive the economic crisis. The so-called PPE fees can range from $10 to $20 or more depending on the practice, and most insurance companies don't cover them. In a statement to WRAL's 5 on Your Side, the North Carolina Dental Society said they are working with the American Dental Association to encourage insurance companies to cover the additional cost going forward. This has been your Coronavirus North Carolina News Brief for Tuesday, June 2nd, 2020. As always, if you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.